To mourn the loss of actor Chadwick Boseman. The tweet sent out by Chadwick Boseman's family confirming his passing on Friday was the most retweeted and liked tweet in history. His death is still a shock to all of his fans, and no one outside his family circle knew he even had cancer or had been fighting colon cancer for 4 years. He was just 43 years old. And here to talk more about colon cancer awareness in honor of Chadwick Boseman is Dr. Olulade. Good morning to you, doctor.
Good morning, Lauren. Thanks for having me.
Well, obviously, this is just such sad news and really shocking to most of the world because, as I mentioned, people didn't know that he was fighting this battle. And when you start looking at the dates, you realize people say, oh, 43 is so young. He was actually diagnosed in his 30s. I have a high school friend who died from colon cancer in his 30s. This is something that happens. What should we know about screenings and how young we should be doing this and who's at risk?
Yeah, absolutely. I would completely echo everything that you said, Lauren. This is so sad and, really tragic. And I'm sorry to hear about your friend. It's important to know that although colon cancer is more common in older people, we are seeing higher rates of this in younger people as well. And so we do need to start, screening and having conversations with your doctor about how to recognize possible signs and symptoms and what your risks are. And in terms of screenings, the age that is recommended that you start screening is 50 based on the U.S. Preventative Task Force recommendations. But because African Americans have a higher risk and incidence of this and a higher chance of dying from this, then it's recommended that they start earlier at 45. But the American Cancer Society has actually gone a step further and recommends that everyone over the age of 45 start getting screenings. But if you do have a family history or increased risk in general, then you may want to screen even younger than those ages.
And what are some of the symptoms that people can look for? Because oftentimes, as was the case in my friend, I'm not too familiar about Chadwick Boseman's family history, but there was no family history known. And so sometimes the symptoms that you do get can be seen as something else, or maybe signs of something else. You're not necessarily thinking cancer in your 30s. What can people look for? What are some of the symptoms that really should raise a red flag?
So some of the symptoms are rectal bleeding, and if you have blood in or on your stool, and also if you have abdominal cramping that doesn't go away, a change in your bowel habits. So if you're someone who doesn't get constipated and you then start to get constipated, and also size and shape matter, believe it or not, when it comes to stool. So if you are, for example, having what we call narrow caliber stools, your stools are thinner, and unexplained weight loss is also a possible symptom. So whenever a patient tells me that they've lost weight, I always ask them, was this something intentional? And it also is important to realize that you may not have symptoms at all. So I've heard a lot of patients tell me that they don't need screening because they don't have a family history or because they don't have symptoms. It's important to recognize that that's not a reason to forgo your screenings, and definitely stay in touch with your doctor, talk to your doctor if you're having symptoms that you're concerned about in general.
So one of the screenings is a colonoscopy, and there tends to be, understandably, people that really think, I don't really want to go through that. I don't want to have a colonoscopy. And your message to them would be, it's not that bad, right?
Yes, and it's not. It's definitely not. This is something that most people actually don't remember. I took my mom in recently to have one done. I'm sure she loves that I tell everyone that. It's mostly painless because you get a sedative, and you also have a prep that you take the day before. But most people do tolerate that, so we don't want anyone to die because they're scared or because they're embarrassed. It's important to get your screenings done.
Absolutely. Well, it's a really important message. We hope people are listening, and thank you so much for helping us out with that this morning. Appreciate it.
Thank you so much. Good to see you.
You too. Thanks, Dr. Olulade.